In this video, you'll be learning about positions used in nursing. But before we go on, what is positioning and why is it so relevant in nursing? Let me know in the comment section. But for the sake of this video, let's continue. We put our patients in different positions in nursing for different reasons. We have the major reason here, which is for comfort. And you can also use some positions to aid the patient's recovery. And then the third reason for positioning our patients is for assessment. There are some positions that will enable you to perform some assessments in the body. Now, the first position I'm going to talk about for the sake of this video is the supine position. What is supine position? If you may ask yourself. The supine position has to do with the patient lying flat on their back with the head facing forward. This is one of the major positions that we use when we sleep. So what are the uses of this position? How do we use them in nursing? Let's look at the following uses. Number one, we use it for physical exam. We also use it for comfort. Like I said earlier, we position our patients so that they can be very comfortable. We use this position for comfort. It is also a post-operative recovery position. Let's say someone just came out from the theater, she has just had an appendectomy or a C-section. The best position that you can put this patient is a supine position so that it's going to aid recovery. The patient can rest properly. But then there are some risks that are associated with the supine position. The major risk here is the risk for pressure ulcer, especially if this patient is unconscious or immobile. Because when the patient lies on their back for a very long time, the bony prominences at the back could cause skin disintegration. Comment pressure ulcer if you want me to talk about pressure ulcer in the next video. But for the sake of this video, let's continue. We said that the major risk of this supine position is that it could lead to pressure ulcer. You find out that the skin in that area will begin to break down and to cause a very big wound for that patient, which you may begin to manage. So as a nurse, you don't want to give your patients more problems. You want to make sure that you solve their problems and don't leave them with problems. This position also carries some risks, and the major risk here is the risk for developing pressure ulcers. Pressure ulcer has to do with a wound that comes from prolonged lying, and this occurs because the bones or the weight of the body presses against the skin, so it could lead to an injury. Let me know in the comment section if you want me to talk about pressure ulcers, and I'll do a video on that. Now, let's go over to the next position, which is the prone position. The prone position is the direct opposite of the supine position, and in this position, the patient lies flat on their belly with the head tilted to one direction. Either it tilts the head to the left or the right, just as shown in the illustration. So why do we use this position in nursing? This position can be used in spinal surgeries, and then it is an ideal position for giving dorsogluteal injection. In case you want to inject a patient on the butt, this is the best position to place your patient so that, especially if you're a novice, so that you can assess the gluteal area and you can know the correct spot to administer your intramuscular medication so that you don't puncture the sciatic nerve. And again, remember when we talk about the supine position and we say that it puts the patient at risk for developing pressure ulcers. Now, this prone position helps to relieve the pressure so that the patient won't develop pressure ulcer. If your patient has impaired physical mobility or the patient is unconscious and can't turn himself, it is important that you change this patient's position from time to time, maybe from supine to prone, from prone to lateral position, so that this patient won't develop pressure ulcers. One disadvantage of this position is that it is very difficult to maintain this position for a very long time because this position is not suitable for people that are having respiratory distress because it can impair the expansion of the chest. So you want to take adequate precautions if your patient is in the prone position, especially if this patient can't move on his own. Now come with me, let's talk about the Fowler's position. In this Fowler's position, the patient sits or lays on the bed while the head of the bed is elevated to between 30 to 90 degrees. And we have three types of Fowler's position. We have the low Fowler's, the semi Fowler's, and the high Fowler's position. So for the low Fowler's position, the head of the bed is elevated to about 30 degrees, 15 to 30 degrees, while in semi Fowler's, the head of the bed is elevated from 30 to 45 degrees, and then in high Fowler's, you have from 60 to 90 degrees. Now, why do we use this position? This position is very useful when the patient is having respiratory distress. You can imagine when somebody is having a respiratory distress and you elevate the head of the bed, it's going to give the chest enough room to expand and then relieve the stress that is associated with breathing. So this is an ideal position for a patient that is having COPD, that is chronic obstructive pulmonary disease or asthma. Let me know in the comment section if you want me to talk about these two diseases, the COPD and the asthma. Now, this position is also ideal for eating. When you want to feed your patient, you don't want to use the supine position because it places the patient at risk for aspiration. That is to say that the food, instead of going into the esophagus, it may go into the trachea and cause problem in the airway. So it is better you place your patient in Fowler's position. This position is also used when you want to insert a nasogastric tube, so that the nasogastric tube is going to find its way down to the stomach instead of entering the trachea. And again, this position can also be used for patients that are having cardiac issues. We see patients that are having cases like heart failure or myocardial infarction. This Fowler's position is a very good position for them because it helps to relieve the stress that they are going through. Now let's talk about the next position, which is the orthopneic position or the tripod position. In this position, the patient sits on the bed and then leans forward with his arms on a pillow or on a table. Now, why do we call it a tripod position? As you all know, a tripod has three legs. So think of think of the body of the patient as one leg of the tripod, and then each of the arm also represents a leg of the tripod. So when the patient assumes the position like this, it is said that the patient is in a tripod position. We use this tripod position in cases of severe difficulty in breathing or severe respiratory distress, especially in COPD and asthma. And why do we use this position for patients that are having COPD and asthma? So when the patient assumes this position, it gives more room for the lungs to expand, and then it reduces the stress the patient is going through. And here is one thing for you. When you are putting your patient on the tripod position, make sure you provide a pillow for the patient to rest on. Or if you can't get the pillow, you can fold a blanket and use to pad it so that the patient will be very comfortable. Remember, in nursing, it is our duty to make sure that our patients are very comfortable. Now, come with me, let's talk about the fifth position that we have on our list for today, and that is the dorsal recumbent position. What is the dorsal recumbent position? The dorsal recumbent position is similar to the supine position, but in this case, the patient lies flat on the back with the knees bent and the feet flat, just as seen in the illustration that you have there. The patient lies flat with the knees bent and the feet flat on the bed. Now, why do we use this position? This position becomes very useful in cases like vaginal examination, cases like catheterization. When you want to pass a catheter, the best position to put your patient is the dorsal recumbent position. The major disadvantage of this position is that it could place strain on the coccyx if the patient stays in this position for a very long time. To minimize this risk, you can place a pillow at the sacral region of this patient or at the butt of this patient so that it's going to relieve the pressure on the coccyx. And again, this position could be very embarrassing to the patient. So make sure you maintain patient dignity and you provide privacy for this patient so that the patient doesn't feel embarrassed. We'll be drawing the curtain here for now. So in the next video, we're going to be talking about other positions that are used in nursing. And also, let me know in the comment section if there's any other topic you want me to talk about. But before then, don't forget to like this video, share it with your friends in nursing school. Each time you like my videos, it gives your friends the opportunity to learn from this video. So don't be stingy with the video. Like it, comment on the video, and share with your friends in nursing school so that they will also benefit from this video. Bye.